And welcome to At Issue. My name is H. Wayne Wilson. Thank you so much for joining us. You are probably aware that there is a shortage of physicians in rural areas, not just in Central Illinois, but across the nation. Specifically here in Central Illinois, Menard, Marshall, Mason, and Woodford counties have all been listed as being short on family practice physicians. We're going to talk about that issue and a program that's in place at the University of Illinois College of Medicine at Peoria that might make a difference in bringing doctors to rural areas. And to have that conversation, I welcome Dr. Tom Goldman. Dr. Goldman is at the University of Illinois College of Medicine at Peoria, where he is a professor and the chair of family and community medicine. And more importantly for our conversation, he was a small-town doctor in
Lockhart, Texas.
Lockhart, Texas.
A number of years ago.
How big is Lockhart?
8,000, or it was then anyway.
And
has great barbecue restaurants there.
Great barbecue restaurants.
That was
all. Also joining us is Jeff Troutman. Jeff is the newly sworn in village president at Princeville.
Correct.
But more importantly for our conversation, you are a volunteer in the Akron-Princeville Volunteer Ambulance Service.
Correct. I'm an EMT with the Akron-Princeville Ambulance and Fire Department, and I also serve as a captain on the Fire Department.
So you're busy enough, and then you decided to take on the village presidency.
Yep. They twisted my arm.
Well, Sid Stahl was retiring, wasn't he?
Yep. Well, I've been on the board for 16 years as a trustee, working with him, and it was a good time to switch over, according to him, so we'll see.
And also with us is Dr. Josh Schubach. Dr. Schubach is a physician with Unity Point Health Methodist based in Princeville, so you work closely with the village president.
Yeah, we take care of the patients there in Princeville the best we can, and Jeff gets them when there's emergencies, and we have a good team there in Princeville to keep people healthy, so we're happy to be there.
And also joining us is Olivia M. White. Olivia is a University of Illinois College of Medicine at Peoria fourth-year student, and you just finished a 7-month, I don't know if that's an internship or?
Yes, a type of internship. It's during the third year of medical school out in a rural community, the RSPP program.
And we'll talk about the RSPP program in just a moment, but first, let's talk about the problem. There's a shortage of doctors across the nation, not just in rural areas. I think there's a shortage of doctors in many types of work. But why is it that there's a shortage of doctors in rural areas? Do you have a speculation on that?
You know, I practiced in Texas and Georgia and Alabama and Illinois. And all of those states had counties, multiple counties, where there were very few physicians, towns that needed doctors badly. And I think it kind of boils down to how comfortable a physician is living in a rural community. A lot of times they've had to live in one to be comfortable there as a physician later, but that's not always the case. If you're a single person and you're looking for a spouse, sometimes there's not enough people around, feel like you want to be in a bigger place to find a spouse. Not as many malls there, although you can shop online nowadays. But just the amenities, the idea of not living in a city, some people find that off-putting. Whereas those of us that grew up in small towns love it.
And Josh, you grew up in a small town.
Yeah, I grew up in the town that I practice in, so I was very familiar with the town before I went back to practice there. And I do think that you know, you're more attracted to the type of environment that you came from, so that is very important. And I think that's what also retains those physicians to those areas and not just gets them there.
How important was it when you went to, how long have you been in Princeville?
I've been there, it's going to be 12 years this summer.
When you, recalling that first time when you went back as the physician, how important was it to build relationships with your patients?
Well, at first I was just very nervous and scared because I'd never been on my own. You're used to being able to bounce things off of other doctors, and then all of a sudden you're the man. You're there and there's nobody to talk to anymore. So I think at first, you know, you had to build confidence, but I think the patients were very receptive. And I think after time getting to know them, I think it becomes a little easier to practice when you're able to build those relationships because you know the patients much more thoroughly, and I think it makes caring for them easier.
You had 7 months was it in Macomb?
Macomb, Illinois, yes.
Did you find the same experience that you saw patients a couple of times and you started to know a little bit about them outside of their physical aspects?
Yes, I did. There were certain patients that I saw many times over the course of the 7 months, and I had a wonderful relationship with them to the point where they were asking for me when they would go to their clinic visits. And coming back to Peoria, very few, if any, of my classmates were able to have that sort of relationship with the patients on their rotations.
When you talk, you've graduated now from the University of Illinois College of Medicine at Peoria.
Yes.
Have you had conversations with those students who did not participate in RSPP, and what was that like?
Yes. So it's been mentioned that kind of the forefront of getting people to learn about the RSPP earlier is going to be helpful in recruitment. And that's what I found with a lot of my classmates. So when I came back from my RSPP experience at the start of my 4th year of medical school, I would tell some of my fellow 4th years who had done their entire rotation in Peoria about some of the experiences that I had had in Macomb. And they kind of raised their eyebrows and said, well, I wish I would have known about this program. That sounds like a great experience. So I think that moving forward, what my classmates and I have tried to do is start talking to the younger students, which will be helped further when the M1 students begin to come to Peoria. We can get the word out even earlier and maybe help recruitment in that way.
And just for my benefit, can I call you doctor now?
Yes.
Okay, Dr. White. So, go ahead, Doctor.
I was just going to say her experience is pretty classic, and the value of that is when these students who are used to traveling in large groups and kind of being the last on the totem pole, when they're put in these communities, they're the only medical student in that hospital. And so they'll walk down the hall and somebody will say, hey, we got a case going on down here, you want to look at that? Or there's somebody in the ER, or can you meet us down here for a baby? You know, anything that's happening, they are the focus for that. So they really get to enjoy a lot of procedures, see a lot of things that their peers really would not see. When I was a program director at our residency in family medicine, which I did for 20 years, when I got somebody that was a graduate of the RSPP program, like Josh, when he went through our residency, they were usually a year ahead of their peers in terms of being comfortable addressing clinical needs, jumping in and doing what needs to be done. They've been doing that, whereas their peers, they would catch up with them, but it would take them about a year to have that same level of self-confidence and comfort. It is a great opportunity.
And even more than he mentioned the responsibility or the being requested to attend different things, being in the delivery in the OR, in the clinic, in the emergency room for different things. What I found was in Peoria, the same as in Macomb, I was responsible to the attending doctor, which is your supervising doctor in training. But what shifted in Macomb was that when the patients start asking about where you are, if you're not in clinic for their visit, I started to see that I'm responsible to the patient. I'm not just responsible for learning as a student anymore, but I'm going to be a doctor and I'm going to be in charge of them. And so there was a shift in my perspective that I need to learn these things because I have to take care of you. It's not because I'm going to get quizzed the next day. It's because I have to take care of you.
Dr. White mentioned that now that we have first-year students and talking about the third year when RSPP, let's explain to the audience why first year is important and what RSPP is.
Okay. Well, the medical school curriculum lasts 4 years typically, and heretofore the first year students have been in Champaign-Urbana, and then after their year there, they would go either to Rockford or Peoria for their downstate, the rest of their downstate education. So we would, in Peoria, we would get them as M2s, M3s, and M4s.
And that's for everyone's benefit, that's sophomore, junior, senior,
correct.
Essentially?
In medical school, correct. And so in terms of the RSPP, which stands for the Rural Student Physician Program, when we tried to present that to the students as they arrived on campus their second year, they had a new house, new place to live, new school to learn, new friends to see. They had a lot of information coming in, and so even though we would tell them about it, it didn't really lodge all that well in a lot of people. Now that we're going to get them as M1s, we have a better opportunity for them to really absorb the information and say, oh, this may be an option I would like to exercise.
And the benefit of this program, I mean, what's the intent here, and how successful is it?
Well, this program was taken from the RPAP program in Minnesota. It's a sidekick of that. That's been there for 50 years, and they have been immensely successful in that state. Here, it started off very small. It's kind of gradually grown. We've had 85 people go through the program. We just celebrated our 20th anniversary of our RSPP. And about 56% of those have stayed in a rural area. About 53%, if I recall, are in primary care. I don't have the breakdown of how many were family physicians, but if you think about, that's probably 30, 35 physicians in rural communities in this state. And if you're in a rural community and you're looking for a Josh Schubach, that's 30 happy towns, that weren't there because of this program.
And that's higher than the national average for
yeah,
placement?
way higher, yeah. It's about 7% of people that are going into family medicine out of medical school. Not all of these people that graduate from the RSPP program go into family medicine by any stretch. They may go into general surgery, they may be family medicine, they may go into pediatrics or med-peds or things like that, but way over half of them are staying in a rural community, which is a really good batting average.
Let me turn to Jeff Troutman, and let's talk about the needs of a rural community. Now, some people would say Princeville's fairly close to Peoria, so you have a little bit of a benefit, but still you're only you're less than 2,000 people.
Right. The village itself is 1,700. Our fire district and our ambulance district covers 72 square miles of rural area, so beyond that. So overall our population probably runs about 5,000 to 6,000 people, including our rural areas that we serve.
And how important is it to keep a doctor? How important is it to not just the residents, but to the community as a whole?
Oh, it's very important. The clinic as a whole is just a valuable asset to any community. It's it draws. It's a draw for getting people out there to live, but it's also a benefit for the people there. They don't have to travel to Peoria or to Galesburg or somewhere like that to get better care. They can rely on our hometown physicians and to get them through.
Is Dr. Schubach your doctor?
Dr. Schubach has been my doctor since he's been there.
How's he doing?
He does great. I trust him for everything I've ever had so far.
The reason I asked that, and I know you were going to say nice things, but the reason I asked that is, you said earlier is that I'm all alone. I'm out here all alone. Yeah, you could probably do some video conferencing or call another doctor. What kind of responsibility do you feel when you're taking care of the entire community's health?
Well, I think, now that we're focusing more on preventative care and health maintenance, we're trying to, bring people around to the culture of preventative medicine. It used to be when I was a kid in a small community where I grew up. We didn't go to the doctor. Most people didn't. The culture of rural medicine is, I think, that they don't typically go to the doctor unless something hurts or they're sick. So I think in my practice what we're trying to do is change that culture, get people in early, so that their disease states don't progress so quickly and get so far out of control that now they're much sicker, and then we can take care of them easier in our community rather than having to send them off to a specialist. So I think that's where we're trying to focus our attention now.
What's the community's response to having both a local ambulance service, and having, and before Dr. Schubach, you had another doctor? So
yes.
Does that keep the community strong? I mean, what's the residents' response to that?
Yeah, without a local ambulance service, for starters there in emergencies, they're going to wait 25 to 30 minutes for an ambulance to come out of Peoria to get them. And that's the whole backbone of what started the ambulance almost 40 years ago, was because of that. But having a clinic in town, a place that people can go, they don't always have to utilize, for small minor stuff, colds, stuff like that, where they can't get into Peoria on their own. They don't have to use the ambulance. They can come up to a clinic, and just having them in there to overall, if we get into a bind, we know we can call him or up there and get the help we need too.
And without the clinic?
Without it, I see a town that slowly deteriorates. It's happened in many small towns across the area where their physicians have left and their clinics have closed, and you tend to, especially younger families, they want to be close when they need help. They want to have it right there. So,
Dr. Goldman, let's talk about some of the impediments to becoming a family physician in a rural area. First of all, my assumption is most students graduate with a fair amount of debt.
True related. It is usually $150,000, $250,000. It's a significant amount of debt to pay off.
Almost $250,000 on occasion.
Easily, that may be a modest estimate. I've known some people having $300,000 and $400,000 debt. So it depends on when they started to have to borrow money, and the cost of the education, whether they go, it's a public university or a private university. So if you're graduating from your residency, these folks are pretty bright, and they to be doctors and to be at the end of their residency. And if you say to them, gee, we can pay you this amount of money, and how long is it going to pay off my debt? Or we can pay you this amount of money, and how long is it going to take? Well, that's looking pretty good there. So primary care doctors don't usually get reimbursed as well. That's changing some and gotten better. But so you have the indebtedness issue to look at. That's being changed a little bit now by the rural hospitals and health systems that provide physicians to rural sites. By forgiveness of debt, they'll pay off your debt for you the number of years that you work for them, and that can be a real attractive thing for folks that are getting out of residency. Also, just as I mentioned before, the comfort of being in a small community. That's one of the things the RSPP does, is it allows students who perhaps haven't been in a small community before to experience that and say, hey, you know what, that was kind of fun. I might want to do that. Whereas they might not otherwise have any idea that they would enjoy that. But those are that and just the conveniences of being in a city.
And I assume that one of the issues might be the cost of setting up a practice, especially if you're not coming in and working under a doctor who's about to retire. If you're coming in fresh,
right.
Malpractice insurance?
Yeah, well, so when I set up a practice in Lockhart, which was a number of years ago, you're buying everything and you're already in debt. So your banker is your good friend and you want to try to keep him healthy for sure. Dr. Schubach talked earlier about the electronic record, and electronic record is a great tool. And a rural physician, if you're opening your own practice and you got to buy your own electronic record and set it up and keep it maintained, that's a lot of money. That's really hard to do as an individual. So that's one of the benefits of being able to work for a system like Unity Point Health or others, which they will help bankroll that for you.
You mentioned the programs that are in place that help either reduce the amount of the loan if you work in a rural community for a period of time. And can you share with us, there's a program called RIMSAT?
RIMSAP, yes.
RIMSAP.
Yeah, so the Rural Illinois Medical Student Assistance Program. So this is a program here in Illinois that's a joint venture of the Illinois Farm Bureau and the Illinois Medical Society. And this is something that I found via Google when I got accepted to medical school. And there's an application process and you're interviewed, and if you're accepted into this program, then they will write you a letter of recommendation into medical school, and they will provide low interest loans through the Farm Bureau. The interest rate is about half or a little less than half of what the federal student loan rate is for graduate student loans. So that's an incentive there.
And Dr. Schubach, did you deal with the IDPH, the Illinois Department of Public Health?
Yeah, I got on with the Illinois Department of Public Health. They offered a year of medical school and paid for a year of service afterwards. So I got in on my second year, so I had my second, third, and fourth year of medical school paid for. and then paid that off in my rural community afterwards. Has to be an underserved area.
I should mention with the RIMSAP as well, for each year that you're receiving the loan money, you're promising service in an underserved area in Illinois as well.
And that IDPH program may not be in existence right now.
I've not looked into it recently
Okay.
since I'm so far out, but it may still be going on.
So you were
to my
very
knowledge.
fortunate.
Very fortunate.
And also fortunate because your clinic is actually aligned with Unity Point Health Methodist.
Very fortunate.
So,
yes.
so EMR is taken care of by Methodist for you?
Yes, it is. Everything's taken care of by the hospital. I just have to do my job and see patients and provide care. So it's a very nice benefit of being employed. And I'm sure there's doctors out there that said there's pros and cons to either, but in my opinion, that's why I am employed, is just because I don't have to worry about a lot of those things.
That's an interesting statement, that he doesn't have to worry about a lot of things. He can focus on his patients. Is there some concern that doctors are worried about, I've got to pay that malpractice insurance, I've got to pay that loan back, I've got EMR, and then patients all of a sudden become just part of the mix instead of the focus?
Yeah, it is. There are many factors that play on a physician. And if you look at, I mean, that's a whole topic. Another topic is burnout and physicians and retiring early, and that covers all specialties and all areas, both rural and cities. So that's another effort that we need to really address as a society, is how can we keep our physicians healthy. They're pouring out their lifeblood for the patients they're taking care of. We need to be sure that they're taken care of as well.
Is it difficult, Dr. Schubach, to stay abreast? You're out in Princeville. Yes, you can call upon Methodist for assistance, but you're a jack of all trades, so to speak. How difficult is that to stay abreast of the latest in technology and services?
Well, I mean, like I said, Princeville being not that far away from Peoria, we still have some connection there with the services and the technology that's available. As far as just staying up on skills and current, the Family Medicine board has a maintenance of certification, which, you know, we're all held accountable to maintain that. So there's a pretty high level of continued medical education that's involved in maintaining your license. So I think that also keeps us up to date in our skills as well.
So how many times have you taken the boards now?
Well, twice.
Twice. I've taken them about 7 times, I think, and just sat for them again about 4 weeks ago. So you have to continue to sit for the boards every so often, because, I mean, one of the knocks on family doctors or general practice doctors back in the old days was that they did their training and then they never cracked a book for 30 years after that. And so when family medicine started in the early 70s as a specialty, they inaugurated the whole idea of, you don't just take the boards once, you take them and you take them and you keep up and you keep up and you go back and learn so that you can keep up with the new innovations. It was the first boards to require that, and now all the boards are doing that.
Are you listening?
Yes,
Your education is not ending.
I'm aware.
Let me turn to Jeff one more time, and I want to talk about building that relationship again. I assume, having had 16 years experience on the village board, now that you've stepped into the village presidency, you're serving very rural communities with your ambulance service. Do you know, I mean, how lucky are you, and have you talked to other communities that don't have that type, you don't have a Dr. Schubach?
Oh yeah, it's a constant issue with the medical clinics, the doctors, as well as us small-time people, your basic EMTs and stuff. Your volunteerism to the community is not there anymore because of time restraints. Kids play several sports now in a year, or one season actually, and it's just, yes, we have that direct involvement, and if the importance of having emergency medical and professional medical available at all times is very important to our community. There are several communities that don't have it. They've relied on outsourcing to other agencies, and it's definitely affected them.
So you consider yourself lucky?
Oh yeah, Princeville's very lucky, and it's very fortunate to have a local person as the doctor in the local community too, and it's not always that case. So.
And with that, we have run out of time. I hope that we've shared a little bit more information about the RSPP program at the University of Illinois College of Medicine at Peoria and how they are trying to funnel some doctors into rural areas to help make up for that shortage. And we thank Dr. Tom Goldman of the University of Illinois College of Medicine at Peoria and Dr. Schubach, who is a physician in Princeville, and also to Jeff Troutman, ambulance and firefighter, and the newly sworn-in president of the village board,
Yep.
and to Olivia M. White, who served an internship and is now Dr. White, having graduated. Congratulations.
Thank you.
And thank you for joining us on At Issue. Next time we'll be back with a discussion about situations facing the Boy Scouts and the Girl Scouts. That's on the next At Issue. We'll see you then.